So the decision to focus on carers in this area was based on some engagement work that had happened beforehand, and they wanted to use the programme to build on that.
We went out and spoke to a lot of people, a lot of events, a lot of questionnaires, and we got a lot of feedback.
We were hearing from carers they just wanted better communication. And they wanted more time spent earlier just referencing where you could get information, where you might be able to meet others in the same situation, and some more specific condition support, so for example around respiratory, so that they could help their loved one care better for themselves.
Carers are the people that will know the most about the person that is in hospital, for example, or in a care home. They will know that person well. So the services around them need to use that expertise.
Originally, the support that I got was from the early onset dementia team, which come in and they sort of look at mum, but they also look at the family as well. And then from there, the person which talked to our family referred me on to young carers. And since then, other than respite care, I think that's the only real sort of support that I've gotten.
The only support I've really ever had is Birmingham Children's Hospital and young carers, like major support. You have people flitter in and out every now and then. I started coming to clubs at first in my local area and met other people like me, and in a sense it's the best feeling ever because you know you're not alone. However, you kind of feel a bit of sadness about it because you know other people are going through what you're going through.
We certainly, in my discussions with colleagues across the VCS in Worcestershire and subsequently with Herefordshire, have been very clear that there are really three areas of support for people: through health, through social care, and we would see the third area as very much being about the VCS, and that those three elements intermingle to be able to provide the best person-centred care for an individual. And if you leave out the VCS from that, you are missing out a huge chunk of resource, of expertise, of skills, and of people who can actually be part of that system.
Actually, none of this cost heaps and heaps of money. A lot of it was just about having the willingness, and that was within our gift.
We started our STP talking about organisations, and then it's broadened out to really now be much more about working together with communities, patients and carers, which is quite different, I think, in terms of scope, and it gives us so much more opportunity for transformation at scale.
So what we found through the programme, that those small and valuable conversations weren't always happening with carers, and what it really needed was a certain level of skills and personal resilience coming from managers in order to embed this into kind of the day-to-day working life of all professionals. So what they decided in Herefordshire and Worcestershire was to create a whole organisational development programme that would include these type of conversations, so making it part of something that would happen for everybody, not just something that people might do if they thought about it or remembered to do it, but that it would be firmly embedded in the programmes of development in the organisation.